Hey guys, Dr. Wukong here from High Point Family Dentistry, and today I'm going to be sharing with you 3 reasons why dentures are a temporary solution and not a permanent one. So for those of you who are thinking about getting dentures, stay tuned because there's some very important information I'm about to share with you. Alright, so we're going to go down the list of immediate drawbacks and long-term drawbacks of having dentures. Reason number 1, and this is a pretty common complaint amongst denture wearers, is that they're just generally uncomfortable. So dentures have a plastic-like feel to them. They don't feel natural like your normal teeth do. So this is an especially common complaint from dentures that have their top teeth done. Here is an example of a lower denture. It's not as big as an upper one. The upper one kind of fills in all that space and fills in your palate. And so it blocks off your taste buds and you're not able to eat as well with them. With the lower one, you put it on the lower gums and your tongue gets in the way and knocks it loose, and so some patients have to use what we call denture cream. They fill in that groove, in that space, and they put it in between the gums and the denture. And as you can imagine, the combination of that paste and that plastic-like feel, it can be difficult to adjust to. And some patients never make that full adjustment into total comfort. Reason number 2, the lack of functionality. And so this goes back to what we talked about previously about dentures not fitting that well. Dentures are, they're kept on by adhesive and the natural suction you get from these dentures. And so obviously we know that teeth are an important role in chewing, and these teeth are held in our jaw by what we call roots. And so dentures don't have these roots, and so when you bite down on something like an apple or a piece of steak or chicken, it becomes difficult for you to eat these foods with the dentures. And so most denture wearers have to either eat soft foods or cut up the meat so that they can eat properly. So imagine having to deal with all this stuff years on end. And so this goes back to our final reason, one of the biggest drawbacks of having dentures. So reason number 3, bone recession. So this is something that most people are unaware of, is that your bones were designed to naturally take opposing forces on them. So what do I mean by that? So here's an example, an x-ray of a patient that had all their teeth taken out and is a denture wearer. So over a number of years, the patient has lost significant bone in their jaw and their maxilla. So here's why this has happened. When you have your teeth, when you chew, that natural force prevents your jawbone from deteriorating, and it keeps that natural bone structure. And so that's why when you see denture wearers, when they're missing all their teeth, they lose all that bone and their bone recedes over time. And that's why most denture patients have that sunken in face look like this, and they have these wrinkles around their lips, is because their jawbone has receded so much. So if you're thinking about getting dentures, make sure you take into account all the factors that we just talked about. Make sure you're aware of all the immediate and long-term effects and drawbacks of dentures. And so I hope this video helps. If you like this video, please click on the like button, and if you know somebody that would benefit from this video, please share it. My name is Dr. Wukong from High Point Family Dentistry. Have a great day.